Hello everyone, and welcome to WUTNews. Today's video is a comprehensive educational presentation about a common but often misunderstood sexually transmitted infection called non-gonococcal urethritis, or NGU. This condition primarily affects men, but can also impact women and is an important public health concern worldwide. Before we begin, I would like to ask you to subscribe to our YouTube channel, WUTNews. By subscribing, you help us continue providing reliable, research-based medical information and health education to viewers across the globe. Please subscribe, like, and turn on notifications to stay updated with our latest documentaries on global health, infectious diseases, and medical awareness. What is non-gonococcal urethritis? Non-gonococcal urethritis is a type of urethral inflammation that is not caused by the gonococcal bacterium, Neisseria gonorrhea. It is primarily caused by other bacterial pathogens, with Chlamydia trachomatis being the most common worldwide. Other organisms such as Mycoplasma genitalium, Ureaplasma urealyticum, Trichomonas vaginalis, and various anaerobic bacteria may also cause NGU. NGU is characterized by inflammation of the urethra, which can lead to symptoms such as painful urination, discharge, itching, or irritation. However, many cases are asymptomatic, making it possible to spread the infection unknowingly. NGU is classified as a sexually transmitted infection, or STI, and is considered a global health issue due to its prevalence and potential complications if left untreated. Historical background of NGU. The concept of non-gonococcal urethritis emerged in the early 20th century when doctors observed patients with urethral inflammation that did not respond to treatments for gonorrhea. Initially, it was often misdiagnosed as nonspecific urethritis or urethritis of unknown origin. The first major breakthrough came in the 1940s and 1950s when researchers began to isolate Chlamydia trachomatis as a causative agent. Later studies revealed Mycoplasma and Ureaplasma species as additional contributors. Modern molecular diagnostic techniques, particularly nucleic acid amplification tests, or NATs, have revolutionized the diagnosis and management of NGU. Today, NGU is recognized as one of the most common treatable STIs globally. The causative organisms. Non-gonococcal urethritis can be caused by several pathogens. Chlamydia trachomatis, most prevalent cause worldwide. Mycoplasma genitalium, increasingly recognized for causing antibiotic-resistant NGU. Ureaplasma urealyticum, often found in asymptomatic individuals. Trichomonas vaginalis, rare in some regions but contributes in others. Other bacteria, anaerobics, and atypical organisms. Each pathogen may require specific treatment, making accurate diagnosis is essential for effective management. How NGU spreads. Transmission. NGU is transmitted primarily through sexual activity. The main modes include vaginal intercourse, anal intercourse, oral genital contact. Transmission is possible even if the infected partner has no symptoms, which makes NGU a silent STI in many cases. It is also important to note that NGU is not transmitted through casual contact, shared clothing, or surfaces. Symptoms of NGU. Symptoms can vary depending on the causative pathogen. Some people experience mild or no symptoms. In men, discharge from the penis, clear or cloudy, painful or burning urination, itching or irritation inside the penis, swelling at the tip of the penis. In women, though less common, NGU in women can lead to vaginal discharge, pelvic pain, pain during urination, increased risk of pelvic inflammatory disease. Many individuals remain asymptomatic, which emphasizes the need for regular STI screening if sexually active. Complications of untreated NGU. If NGU is left untreated, it can result in significant health issues. In men, epididymitis, inflammation of the epididymis; prostatitis, inflammation of the prostate; recurrent urethritis. In women, pelvic inflammatory disease, PID; infertility due to tubal damage; increased susceptibility to HIV and other STIs. In both genders, increased risk of transmission to sexual partners, persistent infections that may develop antibiotic resistance. Diagnosis and testing. Accurate diagnosis of NGU is critical and involves physical examination, urine testing for Chlamydia, Mycoplasma, and Ureaplasma, nucleic acid amplification tests, or NATs, highly sensitive and widely used, swab tests from urethra or cervix. Self-diagnosis is not reliable. Laboratory testing ensures proper identification of the causative organism and guides effective treatment. Treatment options. Treatment for NGU is pathogen-specific. Chlamydia trachomatis, azithromycin or doxycycline. Mycoplasma genitalium, azithromycin, with caution due to resistance, or combination therapy. Ureaplasma urealyticum, doxycycline or macrolides. Symptomatic relief may include pain relief and supportive care. It is crucial that patients complete the full course of antibiotics. Sexual partners are tested and treated simultaneously. Abstinence is maintained until treatment is complete. Prevention of NGU. Preventing NGU involves safe sexual practices and personal health responsibility. Consistent and correct use of condoms, limiting sexual partners, open communication with partners about sexual health, regular STI screenings, especially after new sexual partners, avoiding self-medication with antibiotics, seeking medical consultation promptly if symptoms appear. Education and awareness are essential for reducing NGU prevalence and complications. Global prevalence and impact. Non-Gonococcal urethritis is a global health concern. Prevalence varies by country, age, and population. Highest prevalence among sexually active young adults aged 15 to 35. Significant burden in North America, Europe, Asia, and Africa. NGU contributes to increased healthcare costs, STI complications, and reproductive health issues. Because of asymptomatic cases, the actual number of affected individuals may be underestimated worldwide. Public health importance. NGU highlights the importance of routine sexual health checkups, accurate STI testing and diagnosis, public awareness campaigns, responsible antibiotic use to prevent resistance. Early detection and treatment can significantly reduce long-term complications and help control the spread of infection. Living with NGU and sexual health responsibility. Individuals diagnosed with NGU should follow treatment exactly as prescribed, notify and encourage sexual partners to get tested, avoid sexual activity until treatment is complete, maintain regular follow-ups to prevent recurrence. Awareness, education, and proactive health measures are critical for personal and community health. Final message and call to action. Non-gonococcal urethritis may not always present obvious symptoms, but it carries serious health risks if untreated. Knowledge, prevention, and timely treatment are the most effective tools for protection. If this video helped you understand non-gonococcal urethritis, or NGU, please support WUTNews by subscribing to our YouTube channel. By subscribing, you help us continue creating high-quality medical documentaries, health education content, and global awareness videos. Subscribe to WUTNews for more documentaries on STIs, reproductive health, infectious diseases, and public health issues. Thank you for watching. Stay informed, stay safe, and protect your health.